I'd like to share with you our study regarding evaluation of chemotherapy-induced oral mucositis in Pediatric Oncology Hospital. This is our hospital in Egypt, the biggest pediatric oncology hospital. And this is the Department of Pharmaceutical Services, the department which I work in, and who carried out that study. In our department, pharmacists are responsible for documenting and observing and evaluating and analysis of adverse events related to therapy, especially chemotherapy adverse events. Oral mucositis is one of the most common adverse events experienced by our pediatric patients in hospital. So we looked at this adverse event because also it affects the quality of life of our patient, starting from ulcers to severe pain and dry mouth, and then inability to swallow, sometimes to malnutrition and the requirement of TBM. Also, sometimes it causes interruption of chemotherapy, which is very important for us to follow. Also, various factors like age and gender and diagnosis of patient and the disease stage and the chemotherapy stage during the chemotherapy course are factors which affect the severity and incidence of this side effect. The aim of our study was to demonstrate the prevalence of chemotherapy-induced oral mucositis in Pediatric Oncology Hospital, to identify patients who are at highest risk of oral mucositis, also to evaluate the level of patient awareness regarding oral mucositis, and also the counseling service of the pharmacy was an important issue for us to see how effective is our counseling procedures and our counseling information giving to the patient. We screened 105 patients on chemotherapy. This is through interviews with the patient or the patient family. Also through screening the medical records of those patients to confirm the demographic data of the patient. Patients who were of different gender, males and females. 62% were males, while 38% of females. Different age groups, different areas of care, inpatient and outpatient areas. And different types of cancer. Results, the overall patient susceptibility was 79% of the patients, 79% experience oral mucositis, which is a big number versus benchmarks, with about 2 events per patient. Regarding the gender, female patients were more susceptible by 85% versus 75% for males. For age groups, we found that older age groups were more susceptible than younger groups. Regarding diagnosis, acute myeloid leukemia patients were more susceptible, with 100% of the patients screened experienced oral mucositis, then non-Hodgkin lymphoma patients, then osteosarcoma, then acute lymphoid leukemia, and rhabdomyosarcoma. Regarding cancer type, now we see that hematologic malignancies are 80% susceptibility, while solid tumor patients are 75% susceptibility. Regarding disease stage, relapsed patients, all of them experienced oral mucositis, while first-line chemotherapy patients were 77% susceptibility. Regarding chemotherapy course, First-line induction chemotherapy was at the top with 42% of the events happened during the first-line induction course, and 20% of the events, reported events, were during pre and post chemotherapy, post-operative chemotherapy courses, then consolidation courses. Severity of the described oral mucositis events, 30% could not be described by patient and could not be screened through the medical record of the patient, while 32% of the events were grade 2, described as grade 2 oral mucositis, then 21% grade 1 oral mucositis, and 12% grade 3, 5% grade 4. During screening the medical records, we faced some problems with matching the patient reports of mucositis versus the physician documentation on the hospital information system. Conflicts were about 38%, 36%, and the appropriate documentation, actual appropriate documentation, was 65%. Grades documentation was also different. About 44% of the documentation of mucositis was accurate with the appropriate grade described by the patient and described at the same time by the physician on the documentation, while 56% of the reported events were not described grades. Level of documentation regarding grades, grade 4, all grade 4 events were documented well, while grade 3 only 26% were 74% were documented, and 62% were documented of grade 2 events, which means that as the severity of the oral mucositis event increases, the doctor is interested in documenting and very keen in documenting the side effect in details. Regarding level of patient awareness on oral mucositis symptoms, they were aware, about 91% of the patients were aware of oral mucositis and the definition of oral mucositis and symptoms of oral mucositis, while 95% were unaware of the symptoms of oral mucositis. Regarding medication use of preventive oral mucositis medications like nystatin, like miconazole, and hexitol oral wash, we asked the patient about the use of these agents as prophylaxis. We found that 89% of the patients reported that they use their medications, while 11% did not use the medications for different reasons. We checked how patients who used medication, how they use the medication in the right way, but we found that only 29% of the patients used correctly their prophylaxis medications, while others who reported they use their medications had different reasons for not using their prophylaxis regularly. Conclusion, our patients were more susceptible to chemotherapy-induced oral mucositis versus benchmarks. Patient gender, age, and diagnosis, protocol stage, and disease stage were contributing factors to the severity and incidence of oral mucositis in our population. Event documentation was suboptimal. Patient counseling was suboptimal. We give recommendations to our healthcare providers to keep attention to patients at higher risk of mucositis, like females and older age groups, and hematologic malignancy patients. More attention also to be drawn to counseling patients on oral mucositis prophylaxis medications. And more attention to documentation was reported to the physician, the oncology department, to improve it. Prophylaxis products that were reported by the patients, they didn't like the taste of the product. Also were revisited by pharmacy to make more convenient choice for the patient. Thank you.
Thank you, Sarah. Any questions to Dr. Sarah? I'm wondering, your patients, were they neutropenic? Was it associated with neutropenia at
no.
the time of the mucositis?
We didn't check that. We just checked during which course after the chemotherapy. So it is the nadir. It was the nadir course because we checked the files of the patient during just after which chemotherapy course the event happened.
Okay.
But we didn't check if the patient was at this time fever and neutropenic, because some of the mothers reported that it was a retrospective, right? Like it was an experience, a past experience of the patient.
Sorry, I missed the prophylaxis you used was only antifungal, you said?
No, and also Hexitol. Hexitol mouthwash is antibacterial.
Okay, thank you. Thanks very much.
Thank you, doctor.
Yes, there is one.
Sorry.
One question, Dr. Sarah, for you.
Yeah. It's maybe not a question. Thank you very much for your data. It's interesting work. You know, maybe it's some like a recommendation. It could be interesting to see the incidence of infection complication, patient who had severe mucositis who hadn't, and I think it's interesting to know the long-term overall survival of this patient, this subgroup of patient. Did you check it or not?
No, we didn't check what happened after that, because our focus was about the awareness of the patient and about the quality of life of that patient. Actually, it started through some reports, observational reports were coming from the mothers and the patients about they have lesions on their mouth. So our focus was to stop that event from happening to the patient, even though there is no infection, but or if it doesn't affect patient mortality or infection rate, we were focusing on the quality of life of the patient.
Okay, you have a good large data, and that's why you can just add it. It
Yes.
could be a good work.
I think this will be our next step after re-evaluating our recommendations application.
Thank you very much, Dr. Sarah.
Thank you.